Hi, and welcome to this week's Monday Live by the ADHD Advocate. And as you know, we've been talking about what is ADHD and how it affects our young people. And so today we're lucky to have Dr. Fivos Cacoullis and Eleni. And we're going to ask Dr. Cacoullis to talk about the benefits of ADHD medication, maybe dispel some of the myths around medication so that you can make better informed decisions about how you can best support your child with ADHD. So welcome, Dr. Cacoullis.
Yes, welcome.
Thank you. Okay. Well, I mean, just to say that I've been working as a child and adolescent psychiatrist now for about 24 years. I think 22 of them or 21 of them as a consultant, and then 3 of them as a trainee. And there has been a real development of practice really across the way with regards to ADHD. And what I would say is it's probably the one part of my job where I can actually put my hand on my heart and say, actually, the evidence base is strongest for use with medication. So there are other elements of my job where I could say, well, it's pretty much evens with medication and other forms of intervention like therapy or specific supports or accommodations. But actually with ADHD, what we know from large worldwide studies is that actually medication improves things much better than any other approach. I think it's important to say that it's had a bad press along the way, and partly that's because often children haven't been managed well on those medications. They've either been underdosed, overdosed, or they haven't been given the range of choices or options that are now available. And in essence, there are 2 groups: stimulants, non-stimulants. The first line treatment are stimulants, so things that people would know as Ritalin, which are available in different release forms. And 80% of children would normally get on with the stimulants if that there might be some side effects at the beginning, but 80% of them actually they do well with no side effects eventually. And the good thing about stimulants is they're very flexible in terms of you can use them on the days you want to use them, and if you don't want to use them, you don't use them that day. There is a small proportion of children who don't get on with those stimulants, and you have to use non-stimulants, and they work not quite as well, and they're not quite as flexible, so they don't have that instant dose level effect. So therefore you have to take them over a sustained period of time to get the effect, and therefore that's a medication that you have to take on a daily basis without any breaks. Now, the reason why I am keen to use medication is not just because I know there's a strong evidence base, but when you actually deconstruct the treatment, what we know is that ADHD medication can improve the symptoms of ADHD or the features. So inattention, hyperactivity, impulsivity, distractibility, all of which can have an impact on the individual and those who care for them. More importantly, though, those children, when they're treated, do better in school, so they can actually perform better academically, and therefore those are the children that, not just through their behavior, but who are actually struggling academically, will get into difficulties. But I think actually another layer, which I think for me is the reason why I'm keen to diagnose or at least find the presence of ADHD and manage it, is because actually we know that untreated ADHD is associated with negative outcomes for young people. So that involves difficulties in school, behavior issues, often during adolescence, delinquency, use of drugs, and later in life, obviously, as adults, they will have less opportunity. They've not managed to get the qualifications that they need to progress in life. Difficulties in the employment area, and even relationally. So what we know is that actually we treat children with ADHD not only to manage the symptoms, not only to improve their academic performance, because it leads to better outcomes and also improves their level of self-esteem and confidence. And I do say to parents, look, do you want to move away from this perpetual cycle of negative interaction with your child where you're saying, don't do that, stop that, because actually, when you're living that experience as a child, it chips away at your sense of self and belief in yourself that you're a worthy person. And that is really, really important. So the bit that gets forgotten is in terms of long-term, untreated ADHD is also associated with adult mental health issues. So things like anxiety, depression, and also, personality issues, which I think are not about the person, but about the fact that the disorder hasn't been managed. My view would be that any parent who does have doubts or worries about medication when perhaps their child receives an ADHD diagnosis should have the opportunity to at least discuss that with the diagnosing doctor. And my view would be, I give them the options of what's out there, what's available. I would give them what my recommendations would be, but it's very much an informed choice that I would want them to make. So I don't say you have to have this medication first, but I think they would know that perhaps if they were going for the second line treatment, let's say the non-stimulant, they knew that they knew what the advantages and disadvantages were for whatever reason. So, I think there is certainly, opportunity for children who do have a diagnosis of ADHD to have the same positive outcomes as children who don't have a diagnosis when they're medicated and managed in this successful way. I was just thinking, Stephanie, Eleni, that I don't want to continue talking, unless there are some questions or some issues or points that have been raised.
I think the biggest question that I get from parents who seek out our coaching services are the reservations about getting started. And I'm wondering if you could just address the reluctance you've seen with parents. What do you see as the greatest obstacle to making that informed consideration?
Well, obviously, when people come to me, I'm a medical practitioner, so there's always the view, or not always the view, but that perhaps maybe a perception that as a doctor, I'm always going to privilege the use of medication over any other treatment, psychological or any adjustments. And what I would say is that's not a correct kind of view of things, that there are elements of my job where I say, there is evidence that actually psychological treatments are just as good, and medication isn't superior. I think there is this belief system that somehow for some of these conditions, which we would class as neurodevelopmental, a bit like ADHD, tic disorder, autism, that actually there are successful psychological treatments, but the overwhelming evidence is that actually those kind of treatments aren't effective, and therefore maybe there's an expectation that somehow if the case is mild, or should psychological treatments be used first. My view would be, actually, we know that with this diagnosis, irrespective of psychological approaches, you will always essentially need to go in the direction of medication. There are some strategies that can be useful as an adjunct to medication. So help with organizational skills, help with certainly moving away from negative cycles of interaction, particularly in parenting. So positive rewards and moving away from confrontational styles of parenting. These are all things that can be helpful But ultimately, if you're wanting to manage to treat those disabling symptoms and features, you really need to consider medication.
Yeah. And as you stated, Dr. Cacoullis, certainly the parent education and becoming better informed and aware of what's underlying some of the symptoms that we see in our children can be hugely beneficial. And it's all about, we believe, sort of shifting the perspective of the parent and learning about ADHD. And those are certainly services that we at the ADHD Advocates can provide.
Yeah. And the other thing that I forgot, the other area were really the accommodations that can take place within school or within education. And again, they are very useful, but a dispiriting feedback that I often get is often when children say that they feel they're being blamed for some of their behaviors, which in a way they're given to believe are under conscious control or volitional. So they say, they tell me that I'm messing around because I'm not focusing. And I think we have to be very clear that this isn't something that children can suppress. They might be able to suppress it for 5 minutes, but then, the usual style of responding and behaving overrides that. And therefore, this is something in terms of the ramifications in behavior that children have very little control of. And that must, again, really eats away at their level of self-confidence. Yeah. So again, I would say, the approach is not just to consider medication. It would be looking at what can be done in terms of the areas of environmental modification, in terms of educational adjustments. But I think, we have to consider it as neurodevelopmental that is largely managed with medication.
Yeah, no, we this is what we see definitely in coaching. We've seen it as parents of children with ADHD as well that have, before medication, after medication. Yes. But we've definitely seen, and obviously we're coaches and we coach these children not only to understand their ADHD, to kind of reframe, but also to set themselves up for success. Where we've come up against some obstacles, obviously when parents, don't have that ADHD lens, it can be difficult for them to communicate in a way that will be received well, and it can really dysregulate our young people with ADHD. So it's really important that, like you said before, Dr. Cacoullis, that the people that our children are working with, the parents included, have got that knowledge and are equipped with the strategies to help support the child, and particularly through GCSEs, A levels, it's really, the pressure is on, even for neurotypicals, it's crippling.
No, absolutely. And, I think given that it's an inheritable disorder, if you're trying to, or if you're attempting to try and convince maybe a parent who has lived untreated with ADHD throughout their life, it's very hard for them to see that there is an alternative, that actually there is a different way of being. I would say within the last 5 years that I have signposted a number of parents of children who I've diagnosed with ADHD to get their own assessments. Because in a sense, it's not that they're struggling to parent, but actually I think the fact that if they're able to focus better, they realize that it actually makes them better parents, just by that process.
Yeah, wholeheartedly agree. Again, from a personal and professional perspective, completely agree. It's so difficult parenting just of itself, but then when you have ADHD, because you're trying to regulate yourself, your emotions, you've got your own executive function difficulties, the overwhelm and anxiety is crippling. So once you can get that diagnosis and get treatment yourself, you can then hold the space, because that's what we've seen very much in coaching. As a parent with ADHD, it's so important to hold the space for your child with ADHD, particularly through some of the meltdowns are extremely difficult. So, but look, this has been so helpful. Thank you, Dr. Cacoullis.
Yes, my pleasure.
And, would love to obviously have you on again to educate some of our parents. And if you're interested in how you can support your child with ADHD, do get in touch with us. We have free introductory calls, www.theadhdadvocate.com. And we've got a workshop for parents in relation to helping set up your child for academic success on the 10th of February. So we'll post some details around that workshop as well on the Facebook page. But thank you very much. And hopefully we'll see you soon.
All right,
Thank you.
take care.
Thank
Bye-bye.
you.
Bye.